Welcome to the Cisco show, ladies and gentlemen. Don't touch that remote. Got a good show here. We're going to talk about the Suez Canal. We're going to talk about rivers, streams, meadows, the whole bit. But the canals and the streams that we're going to talk about don't carry water, carry blood. So my guest today is Dr. Dominic Bontempo, who is a surgeon that takes care of the veins and all. It's a big fancy word, you know, so, but I'll let him tell you all about it. But this is one thing, that all these little veins and arteries that lead to the heart, and that's what he takes care of. And it's so important, you know. You don't want no roadblocks, you don't want no detours, and this is the man that keeps that heart pumping. You know, you want to stay healthy, you got to, when in doubt, check it out. My guest, Dominic Bontempo. I know your dad. Now tell me something about you and your dad. Tell me all about it. You're a homegrown kid.
Yeah, I grew up in the area. Was born in Norristown. I actually went to Rittenhouse for a while.
I did too.
Yeah. My family moved to White Marsh, and I ended up going to PW, graduating from there. I was saying I played football with a couple of the local doctors.
Tell me about some of these doctors.
Glenn Miller was a tight end. He's a doctor from Conshohocken.
Yeah, Glenn Miller. I remember I had him on my show here.
And Sam Paleo is an orthopedic surgeon from Norristown.
Right,
and Sam, both Glenn and Sam were very good athletes. I played, but Glenn and Sam were good.
What position did you play?
Defensive end, tackle.
Oh yeah.
Yeah, I was a lineman.
Yeah,
no glory at all.
Dr. Paleo, he gave me 2 hip replacements, you know. They're still working, you know, so no problem.
Well,
tell me something about your dad, you know. He was very well known. I mean, I told some people you were going to be on my show. Oh, yeah, I know his dad, you know.
No, my dad was here in practice from the 40s.
But he was a family physician, right?
Well, he was a family physician for a while and then did surgery. And I actually, after I finished my residency and my fellowship, I came back and went into practice with him. And we practiced together for, I guess about 15 years before he retired. And that was fun. I love working with my dad. My dad was a great guy. He was fun to work with.
He was big, right?
Not nearly as big as I am.
Well, how big were you? Tell me something about you.
Before I went on the diet, I was over 400 pounds.
What?
Now I'm down. Now I'm down to 125, 128 as of today.
That's what somebody told me because I hadn't seen you for a while, and I said, "Make sure you have a chair big enough for him." Yeah. So we're all right. You fit in there good.
No, I fit in regular chairs now.
You weighed 400?
At one point, I did.
And then, so now, what do you weigh now?
About 280.
All right.
Yeah, and I still got a way to go. I still want to lose another 30 pounds.
It's all right. Don't get too much now. You want the heavyweight division is pretty good, you know. Stay within that heavyweight.
No. I'd be more than happy to go down a little bit further than that.
I know you talk about the veins and all, but how did you do it? Just stop eating or what?
I went on a diet.
No operation or anything?
No operation. As a matter of fact, I gave myself sort of the little motivation. I said, if you don't lose the weight this time, I'm going to have the surgery. And I guess that was motivation enough to get me losing the weight.
Yeah, sure, right.
That, and I took a golf lesson, and the pro told me I was losing distance on my drive because I couldn't get my arms around my belly.
Uh-oh.
Got to have something.
Hey, them golfers, get that now. Get rid of that belly, maybe get a better score.
Well, I'm hoping this spring, we're going. A group of us go down to Florida every year for a week.
What, you go with different, your friends?
This will be the 26th year this group has gone. We all get together.
Yeah, because I think one other doctor told me he was going to. Who was it? Dr.
Dr. Muscarella goes with us. I'm sure
right.
He goes.
Yeah.
He's the guy who organizes it all. He's.
I had him on my show, and I said, "You're a foot doctor." And I said, "Any politicians come in there with their foot in their mouth, you know?" But
Vince would be the one to take care of those.
So you work out of where?
Well, I work out of Mercy. I'm also on staff
Mercy Suburban
at Stein and at Abington and Lansdale, but I work there either of those places very rarely. I work out as essentially Mercy.
Mercy,
and I've been there. I was born there, so I've been there forever.
Yeah.
But
they did some improvements there. They just built another building there.
Oh yeah, they put a new cancer center on. They built 2 or 3 years ago. They built a new OR, new emergency room. They've put in a lot of money in to improving the facilities.
I know Brian Terrence. He's on the show here. He had some couple people there here. Now, what is this vascular?
Vascular surgery is what I do.
Tell me what it is.
We take care of arteries and veins. In the past, it was almost all arteries. These days, we're doing more and more with veins as well. But, you know, the arteries carry the blood to the tissue, the veins carry it away. A lot of times as we get older, especially...
What takes it to?
Arteries.
Arteries. And what takes it back?
Veins.
The arteries are bigger than the veins.
No, it's usually the other way around. Veins are usually bigger, but the flow in the artery is a lot higher pressure and it's a lot faster. So even though it's a smaller tube, it gets the blood there, and then the bigger, slower veins bring it back.
Oh.
But as we get older, especially if you smoke, you tend to get hardening of the arteries. The arteries get blocked up, and it depends.
Corroded.
Right, right. And it depends where the blockage is. If it's in the artery in your neck, it can cause you to have a stroke.
What is this? Doctor, what's that? Is that an artery?
It's an artery. It's called the carotid artery.
And it goes right to your brain, I guess.
Goes right to your brain. And they tell me the brain is a very important organ.
Yeah. It comes in handy once in a while. Yeah. It don't help you at the casinos, though.
No.
No brains
Nothing
down
seems
there.
to help me much there. But yeah, we can fix the carotids when the blockage. The idea is to find the blockage before it causes the
Well, how do you
stroke.
find it?
Well, generally your
X-ray.
family doctor, when he does your physical exam, will listen to your carotids, and if there's an irregular flow, often there's kind of a funny noise when you listen to it. If you hear that funny noise, you get an ultrasound. Nothing painful, relatively simple. It only takes a few minutes. And the ultrasound gives us a pretty good view of the artery, and it tells us within a range how much blockage there is. Now, if that shows a significant blockage, we then go on and do another test, and that would either be a specialized CAT scan or a specialized MRI. And that can give us more information. And then fixing it these days is usually surgery, but...
when you say you fix it, is there an area where it's blocked? What do you do? Cut it out or?
Well, you know what? It's a lot like plumbing. You got a blockage, you go in, you open up the pipe, you clean it out, and you close it.
Yeah, you don't charge like the plumbers, though, huh?
No, as a matter of fact, I wish I could charge like the plumbers do.
Yeah.
No, we don't.
In other words,
get
rid
charged
of the bad part.
Get rid of the bad part.
And then how do you connect it? Sew it?
Well, it depends on exactly what you have to do. Most of the time, we open the artery, in the neck, we shell the plaque out, and then just close it again. But in other places, like in the legs, when we do bypasses, taking the plaque out is much more surgery than just putting a bypass in around it.
What do you mean you take it out? You suck it out, or?
Well, we don't. Oh, in the neck?
Yeah.
Yeah, we just shell it out. You just go into the wall and free
that's
the
the
plaque
corrosion
up
in
from
there,
the wall. Right. And so it leaves you with a nice big open artery when you're done. In the legs, we do bypasses because if you have a long blockage in the leg, you have to make a big incision to get the blockage out. If you're just doing the bypass, you can make much smaller incisions, and you start above the blockage and you put the tube in and you hook it to a good artery below. So you need a good artery above and a good artery below, and you just go around it.
Oh, it's
and that's less surgery, and that's pretty successful too.
In other words, all the veins and arteries that lead to the heart and also to the brain. But once it gets to the brain, you don't fool with that. You fool with the transportation.
That's for neurosurgery.
You're the traffic manager.
Right.
Right?
Yeah.
Is that a good word, traffic manager?
That's exactly what I do. I think of it more like a plumber, but yeah, that's...
Yeah, the plumber. Well,
we
it gets more classy. You know? All right. What, if there's a blockage, does it necessarily have to be surgeon, or is there something to dissolve?
No. Well, if the blockage is clot, there are things to dissolve it. But these days, probably only 1 in 4 of all the blockages we deal with do we actually operate on. The majority are taken care of these days with balloons and stents. And that's been something that's changed maybe 10 to 15 years. Vascular surgery is a pretty new specialty. I mean, it didn't exist 70 years ago. And there were 3 things that had to come together. We had to get a drug to stop clotting. We had to get a material we could use for bypassing and suture that we could use to sew with. When we got all that together, that really was the 60s. So vascular surgery started in the 60s. The guy that trained me was Fred Reichel. He was one of the founders of vascular surgery. And it was interesting when I was in my training, because vascular surgery is 2 years after 5 years of general surgery. which is after 4 years of medical school, which is after 4 years of college. So it
Wow.
was 15 years altogether. But in the 2 years that I worked with him, I got to meet almost all the founders of vascular surgery because they would come to visit each other.
Right, because he was the
And
top.
it was great. But in the last 10 or 15 years, it's changed. It's become much more interventional, much more done with catheters and wires and tubes and balloons and stents through very little holes.
Can they do it from the outside now?
We do it. We do aortic aneurysms all the time that way, through a little incision in the groin. Instead of a whole big incision the whole length of the abdomen, little incision in the groin, we pass a tube up, and the tube has a balloon, and then on the outside of the balloon is a stent, and outside that is a graft. And from the inside, we stick that thing up in there, we open up the balloon, that pushes the stent into place, and the stent holds the graft in there. So we don't have to go and make a great big incision and do... Now, we still have to do that surgery once in a while when people don't have the right anatomy to do the balloon and the stent. But 9 out of 10 these days, we do that way, and the people go home the next day.
Wow.
Whereas before, it would have been 10 days in the hospital and 6 weeks recovering.
Almost like cataracts.
Very
Like
much.
cataract, that was now, they used to keep you in the hospital 3 days, and you couldn't sleep, you couldn't open your eyes. Now, boop, boop, 15, 20 minutes, sit down, boom, you're out, next day. Same day. You know.
And it's gotten to be very much of that interventional. And because of that, instead of it just being vascular surgeons that do this now, this is now a multi-specialty thing. And we work with the cardiologist and we work with the interventional radiologist
Well, when
as a
you're
team.
doing this here, who do you have beside you?
Well,
who do you have for
it
emergency?
depends on where I'm working, what I'm working. There certainly will be another surgeon there who would be there to assist. There would be a circulating nurse, a scrub nurse, there'd be 2 anesthesia people. But these days with the interventional, there may very well be a radiologist, there'll be radiology technicians, and there could be a cardiologist. It depends on what we're doing, whose specialty we need to work with.
Now, when the last hip replacement, I had Dr. Samuel Plow. During the operation, they said my heart was going boop, 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 wasn't going boop, boop enough, you know. And so it was a little scary, so they did something to keep me going. Then afterwards, Dr. Blasco told me that the best you get a pacemaker, see, and that would help. And now it goes boop, 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 you know. So now the pacemaker, does that involve you in any way?
Actually, I don't put them in, but I have partners that do, and that was a choice I made years ago. But but the pacemakers are relatively simple.
The guy that put it in for me has a big long name. I can't think of his name, but
It's probably Dr. Polsky.
Huh?
It was probably Dr. Polsky.
Yeah, well, no, him, but there was another guy. He was there. Polsky was, Polsky's the one that did it. But then when I had to go to follow up, it was another with the big, well, I think it was Russia or someplace. Russia or Australia, someplace, whatever. He did a nice job, though. Then they took me to, then I had an infection in it, and then they had to take me to Lacanau to change it and put it from one side to another.
the other.
You know. But, I'm still bobbing and weaving at 89. They can't complain, you know what.
Just as just as long as you know when to duck, that's all.
Now, I'm a former professional boxer, and I understand you work out.
Since I've been losing the weight, I've been going to the gym 4 or 5 days a week. And I go to a gym around the corner from here called Iroy's most of the time, but I also been going to a boxing.
Take a look at that. Huh?
Also been going to a boxing gym.
Oh yeah.
And the boxing gym, there's nothing more fun than putting on a pair of gloves and hitting that heavy bag.
Yeah.
I love it.
Now, do you hit it? Do you notice?
As hard as I can.
What? Yeah. No, you're not supposed to do that.
I know.
You're not supposed to do that.
Coach yells at me all the time.
I
got 16-ounce gloves on. I could hit a truck and it wouldn't hurt my hands.
When I was a stablemate of Rocky Marciano. My trainer was Charlie Goldman, one of the top trainers, and and then everybody hits a punch. So I go over there, now mind you, and I want to try out if he would take me to manage me, a big manager in New York. So I start hitting the bag. I go bam, 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 and I push the button, bam, 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 boom. Wait a minute. He says, you see that bag? That's a punching bag. It's not a pushing bag.
Yeah.
And what I would do is and that's a bad habit. I see fighters, you watch some of these fights, the guy's in the clinch, and he's wasting his energy by pushing the guy away. Don't do that, 'cause, you know what I mean? And so now every punch, everything is a punch. It's uppercut. And then when you throw uppercuts, Your palm's got to face you at all time, whether it's a left hook, right hook, uppercut, straight right hand. It's always palm. And your elbows have to be close to your body. See? The further away, the less punch you get. See?
That's right. And keep your hands up.
Right, hands
because
high.
I'll tell you, if I don't have my hands up, the coach reaches out with that mitt and smacks me in the head.
You throw the jab, and then this shoulder comes right up, and you throw your right hand, and boom, you shoot it. And actually, you throw the right hand is just like your body is like a door, and you slam it, boom. You bring the body around with the punch, because you just go like that, it's no power. Oh, well, that's another story now. Yeah. Now, what is the latest techniques or technology that in this as a surgeon? What are some of the latest?
The biggest meeting of the year is up in New York every year in November, and I was just there, and they present new technologies all the time, and it's amazing what people are doing. I was talking about that aorta that we do that I feel is new, but they had a special dinner for the guys who did the first ones. Up there, and they did the first one of those aortas 20 years ago.
What is that? Remind me.
The aorta is that thing where we make the real little incision and pass the thing up with a stent.
What do they call it?
It's called an EVAR.
Oh, okay.
It's called an EVAR.
What's this here one here? I can't read that.
Oh, that's aortic aneurysms. I can't read my writing. I don't blame you.
What's that? I know doctors. I can't read your
an aneurysm.
Prescriptions and your.
Yeah. Well, prescriptions are mostly Latin abbreviations. You're not really supposed to be able to.
Oh, you got an excuse then.
Exactly. But no, an aortic aneurysm is an artery that dilates up. It gets the hardening of the arteries, instead of causing it to narrow, causes it to dilate. And if it gets to a certain size, there's a risk of it rupturing.
Well,
and when aortic aneurysms rupture, you almost always die, and you can die very quickly.
I think my brother-in-law, that would happen to him.
Yeah.
But what are some of the signs? Is there any indication or?
Well, the most common presenting symptom from an aortic aneurysm is death. They generally don't cause symptoms ahead of time. It can cause a little bit of aching in the belly or in the back, but most people don't get any symptoms. And that's and the aorta is all the way in the back of your abdomen. So if you're like me, you can't even feel it, because it's that far down inside.
I often wonder about that when a heavy-set guy has to get an operation, had to cut through all that.
You do,
fat.
And you got to make the incision bigger, and it takes longer. I always said they should pay us more, but the insurance companies don't want to hear that.
All right, what else I got here? What else I can't read that one out there.
Oh, that's the carotid arteries. That's that artery in the neck that we talked about,
and this here one.
Peripheral arteries. That's the stuff in the leg. People, the symptoms you get there, the most common presenting symptom is called claudication, and what that means is you get pain in your calves when you walk. And if we see people like that, we can get to them before it gets worse, so we don't have to do amputations. There's medication that can be used to help thin the blood a little bit, and sometimes that's enough. A lot of times just getting them to stop smoking and start walking and watching their diet is enough. Yeah. But most Americans don't want to do that. They'd much rather have an easy fix and keep smoking and eating all the cholesterol.
But it takes a certain person to be a physician, surgeon, right? Blood.
Well, yeah, you have to be able to see blood. I know we get students in all the time.
Tell me something about that.
Who watch us do the surgeries, and it's not uncommon for the students to faint. Now, I was saying I had one student that was there with us assisting when we were doing an amputation, and as we started to pull the leg away from the body, this student fainted, and she didn't. Most of the time people faint, they just sort of crumple slowly to the floor, and we can catch them. She went flat out, she went back, and she fell, and she hit her head on the floor, and you could hear it ping. She was unconscious for 4 hours.
Oh my God.
We had to admit her, we had to get a CAT scan. She was in the hospital for a couple of days.
But she survived.
She survived, and she's now a psychiatrist.
Oh my God.
She's never going to see blood or a surgery again.
I was wondering, we were talking about how people fall, and I think if it's a woman, when a woman faints, she goes, ah, and when a man faints or something, it goes forward. Is that true? That most of the time?
To a great extent it is. We see it with kids. Little boys, when they fall, come in and they got a cut on their chin. Little girls, it's always the back of their head.
How about that?
And it's just different anatomy.
It's just yeah. I know I mentioned earlier, because we were talking about boxing, When you see two guys fighting and the guy hits the guy and hits him on the chin and he goes back, he usually gets up. But when the guy gets a bang, 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 and he goes forward, very seldom gets up, because it's some, But how do you train yourself to, every day? You don't know what you're going to go into in the operating room. Everything is prepared. How do you prepare yourself?
It's not that. The training is many years. It starts in medical school. You get some exposure to surgery. The first week you get exposed to dead bodies in an anatomy lab, and that's a shock.
They hit you in the beginning?
Oh yeah.
We had scared the heck out of you, so you.
Well, we did have somebody in my class freshman year in medical school who walked into the anatomy lab, looked around, and walked out, and never came back. Yeah. I mean that's I think it's a terrible waste, but some people just can't handle it.
Right.
But what happens is as an intern and a resident, you get more and more exposure as time goes on. So you learn to handle the problems.
You can handle it, yeah.
And you don't get thrown into these situations all at once. You get a little bit of training, a little more at a time, a little more at a time, and you get what you can handle. And if you are the kind of person who doesn't like blood, you don't choose to go into surgery. You become a family doctor, or you become a psychiatrist, or
When I was with the Norristown Police Department, I drove the emergency wagon, and I had to go on different accidents and different things, and suicides and all. And one particular one, there was a girl, an abortion. The guy went in the bathroom up in the second floor, around Willow Street, someplace, and they had an abort. And they wrapped it in a paper bag and got it and took it outside. I guess you call it a fetus, right? Mm-hmm. And it was out by the tree. And so there was a blood all along the living room, up to the stairs to the bathroom. And this lady's there like this, she's out, and the guy was over there. What's going on? See all this blood. We didn't know what's going on. So one of the police officers coming, I called for assistance, and he came. So he's just kind of looking around, and he opened the bag, and he looked there, and he fainted. 1 month later, he left. He said, I can't handle it, because what he saw, the blood and all that stuff, And it happens, I never had no training. When I became a policeman, they just give me a gun and a badge, put me on the street. I had no training. And then over at Sears, when Sears used to be on Markley Street, they had a student, came from Europe, exchange student, and he was over here to study, and he failed. And he committed suicide over at the Sears Roebucks. They used to have the guns in racks, and the guns and the bullets were right there. He put it stood there, so when I got there, there's blood all over the place, pieces of skulls, and I said, oh my God! But I did it because I was busy, helping out with the coroner, getting the pieces of brains or the skull. What do you think I had for supper when I got home? Spaghetti. Red spaghetti. I stole my own.
Yeah, but you didn't have any trouble eating it, right?
No.
Yeah, I never have any trouble eating either.
No, that.
I don't get to see the stuff at the scene, and I'm kind of glad.
What?
I don't get to see those kind of things at the scene of the crime, but I get them after they've been put on a litter and taken in, and that can be pretty gruesome too.
Well, it's the same thing when I became a policeman. I never saw a dead person. The only dead person I ever saw was in the casket, all dressed up, and And then you find them in all different suicides and shooting, swimming, drownings and all, So it's but I don't know. Now that I'm retired, I think I could help. I think I could do it. I don't know if I'm going to be able to do what I did before, but I don't think I'd run away. I think like if an accident, I was always had it happen where I'd say I could stop and help somebody, Yeah. But
not everyone can though.
No, it's the same thing. Now, you mentioned something about a heart doctor that had to operate, and what did, on a heart?
Oh, the heart doctors are
what's the story there?
They're a different kind of person. If you have a job where you have to go in and stop the heart, fix it, and start it every day, you have to have a tremendous amount of confidence in yourself. Obviously you get it from the training, but you really have to be a kind of special person to be able to do that.
While you're operating, the heart is working someplace else.
Yeah. Another term comes to mind though after dealing with the heart surgeons, and confidence is one thing, arrogance is another. But because they do tend to be arrogant. But it's
Oh,
part
yeah,
of
I
it.
guess
I mean, if you're that confident, if you're able to do
Sure, they
those
command-
things,
they
and
give orders.
every day you can go in and start, stop the heart, fix it, and start it again.
Yeah.
You get to be.
I remember when my father had a shoemaker shop on Main DeKalb Street, and I used to shine shoes. And Dr. Jenkins, he was a surgeon. And I remember he always had wore gloves, in the summertime and the wintertime, And I said to this guy, so what's the story? Oh, he's a surgeon. I don't know. I don't know. What does that have to keep their hands warm or something?
No, that was an affectation. But I mean, when I work in the yard, I wear gloves. When I go to the gym and lift weights, I wear gloves because I don't want a lot of thick calluses on my hands.
Yeah. Okay.
The only problem I have is I do play guitar once in a while, and I would like to have some calluses on the tips of my left fingers because it gets painful when you lose those calluses.
Well, what influenced you to become a doctor?
Well, really, I think the biggest influence for me was my father, and not because my father ever told me to become a doctor.
Did he have an office on Smith Street?
Oh, yeah, an office on DeKalb.
Huh?
An office on DeKalb.
Didn't he have one on Smith Street?
No, I don't think so.
On the corner of the in-house and Smith, it goes into Arch, where Arch goes into Smith?
That may have been before my time because
Yeah, I think so. I remember.
because he had one down in Norristown for a while. I know that, and then he moved it out to 1600 DeKalb, 2 blocks above Sacred Heart.
Oh, okay.
And
But if I remember, when I was a policeman on patrol, I'm pretty sure it was a sign
Yeah, it
out
might
there,
very well
Dr.
be.
Bontempo, and it was like where Arch Street gets into Smith Street,
Yeah.
and in the corner, and they had a gate. So,
that was
is there
before my
anything you
time.
want to? We only got about a couple of minutes here. Is there anything wrap up that somebody that we have students here at Norristown High School that maybe they want to become a doctor or something? What do you think they should be studying or looking out for, preparing themselves?
Well, I'd love to say, I knew exactly what it is they're supposed to study. And I'd have to say, you want to study the sciences, biology, but what we teach today, with the way the technology is evolving, may not be useful in 10 or 20 years. I mean, all the things I learned in college are outdated
Obsolete.
now. Obsolete, yeah. I mean, you have to keep learning, and that's the important thing in medicine. Fortunately, I love to learn. I keep getting new certifications. I got certified in wound care 2 years ago. I'm going to get certified in hyperbaric medicine. I've got that'll be 4 certifications I have, and I do that not because I have to, but because I really enjoy learning.
Yeah, right.
I want to keep up, but I enjoy learning. You know what I really want to do when I retire?
What?
I want to go to Italy and I want to do a semester abroad. I want to be a college student in Italy. I want to learn Italian.
College student.
I want to learn Italian. I want to learn art history. I want to study. I want to
If you go to Italy, what's your favorite Italian food?
Oh,
come on.
Geez, I mean, my favorite food of all time is spaghetti and meatballs. But I don't think there's any Italian food I don't like. I love it all.
And then we do it on Christmas, the 7 fishes. Ladies, and thank you very much for being there. Thank you,
My
ladies
pleasure.
and gentlemen. Thanks a lot for allowing us to come into your living room. And I hope that you got something out of our conversation here. I know I did. And so if there's anything you want to know more, just look up my HankCisco.com, and we'll get some information for you. Okay? So until we meet again, keep bobbing and weaving, and keep your trunks off the canvas. Okay? All right, doctor. Thank you very much.
pleasure.
And here we go here. Ala salud, that means to your health.
Salud.
And that's what you got your health, you got everything.